Speaker, a question for the Minister of Health. Does he agree that older New Zealanders who live in rest homes are among the most vulnerable in our society? And is he satisfied that all rest homes provide safe levels of care for residents, as they're required to do under the Health and Disability Services Safety Act 2001?
The Honourable Tony Ryle.
Mr. Speaker, yes, and generally yes. And I also agree with the Auditor-General, who last year issued a damning report that the previous government did not respond quickly enough to address the weaknesses and risks in the arrangements it had known about since 2004. The new government is tackling these years of neglect in a number of ways.
Sue Kedgley.
How can he ensure that rest homes provide safe levels of care for residents when there is no minimum training or qualification needed to be a caregiver, and when many people literally walk off the street with no prior training or experience and begin caring for our vulnerable elderly?
The Honourable Tony Ryle.
Mr. Speaker, there are a number of training programs in place for those who go and work in aged care. The government was also concerned about the lack of investment in nursing quality and supervision in rest homes, and that's why we put an extra $18 million in last year as part of that need.
Sue Kedgley.
How can he ensure that rest homes provide safe levels of care for residents when, according to the Nurses Organisation survey, large numbers of unregulated caregivers are doing jobs that would normally be considered the domain of registered nurses, such as administering medicines without supervision and even drugs like morphine?
The Honourable Tony Ryle.
There are very clear rules about who should be administering drugs anywhere in the New Zealand Public Health Service, and if the member has any information about breaches in that should be made available to the authorities. What this government has done is we are beefing up the audit and compliance regime associated with rest homes in order to ensure that the problems that were identified by the Auditor-General are addressed.
Joe Goodhue.
Thank you, Mr. Speaker. My question to the Minister: what were the conclusions of the damning Auditor-General's report on the monitoring of rest homes?
The Honourable Tony Ryle.
Mr. Speaker, last year the Auditor-General's report identified long-standing shortcomings in rest home monitoring. The OAG report found that under the previous government, the Ministry of Health had struggled for years to ensure the quality and safety of the nation's rest home services. The Auditor-General was highly critical of the lack of action between 2002 and 2008, and the Auditor-General was particularly critical of the agencies that audit rest homes, and that is a concern this government shares. The same report recognised the action that the new government has underway.
Ross Robertson.
Thank you, Mr. Speaker. To the Minister, considering that this government is clearly turning a blind eye to elder abuse in rest homes, does this government intend...
A point of order has been called. The Honourable Drew Brown.
Mr. Speaker, I wouldn't normally take a point of order on a new member, but this is a very, very experienced member. Been in the House for some 35 years, and I would have thought it quite inappropriate to start a question in that manner. It is question time, not statement time.
The member's
and
point...
I also want to know if he's got a hat to go with that scarf.
The member's point of order is perfectly valid. What I normally do is I don't intervene. The more comment like that a member makes in asking the question, the more licence a minister has to be political in their answer, and that's the way I normally balance it. But the member's point of order is absolutely correct. The member should ask a question rather than make the point of order. The Honourable Trevor Mallard.
Speaker, I think before you absolutely endorse the point of order, you might want to check the Leader of the House's maths. He clearly can't add without his shoes off.
Order. Order. I'm not sure what that's got to do with order. Order. Ross Robertson, please, on a supplementary question.
Speaker, and indeed he should have his maths checked. Mr. Speaker, then to the Minister, does the government intend to continue to turn a blind eye to elder abuse in rest homes? And does it intend to do anything about the other issues for the elderly that Grey Power raised yesterday, namely cutting home help, cutting hearing aid subsidies, cutting elder abuse education programs, cutting elder driving courses, allowing ever-increasing electricity bills and transferring the financial burden of the ETS from the polluter to the taxpayer?
Mr. Speaker.
The Honourable Tony Ryle.
Mr. Speaker, what I would say is, where was that member for 9 years when the Auditor-General was slamming that party opposite for their behaviour with the rest homes in New Zealand? This government has done more than any other in the last 18 months to address those issues. We're now auditing the auditors. We require the auditing agencies to have international accreditation. We're provided additional funding. We've introduced spot auditing, and we now have transparent reporting online of rest home quality standards as per the audit, where that's colour-coded for easy reference. Blue is very good, and red is very bad.
Sue Kedgley.
How can he ensure that residents living in rest homes now are provided with safe levels of care when nurses working in the aged care sector report that they are responsible routinely for the care of as many as 64 residents and are so overworked they simply don't have time to care for residents properly or safely?
Honourable Tony Ryle.
Mr. Speaker, what I am well aware of is that the government has put an additional $18 million in last year to improve the nursing quality and supervision in rest homes. We've increased the subsidies a further $16 million this year. We're putting a considerable effort into improving the auditing and compliance regime. And as I travel around rest homes around New Zealand, nurses are giving me a very clear message that the neglect of the previous regime is being addressed by this government.
Point of order, Ross Robertson. Order, point of order, order. I say to the Honourable David Cunliffe, point of order has been called.
Thank you, Mr. Chairman. Mr. Chairman, given the government's barracking during the asking of my question, I'm therefore seeking leave of the House, sir, to table the media release put out by Grey Power yesterday, given the government didn't
the House
believe
is not
it.
about to do that.
I'm seeking leave.
Question number 3, David. I beg your pardon, Sue Kedgley. Supplementary question.
Thank you. Isn't it the case that as long as there are no minimum staffing levels in the sector or formal qualifications or training required to be a caregiver, that he simply cannot ensure that rest homes provide safe levels of care for residents? And does he concede it was a mistake for the government to veto a select committee inquiry into aged care?
The Honourable Tony Ryle.
Mr. Speaker, no, it was not a mistake for government members of the Select Committee to not have an inquiry into aged care, because frankly it saved that member who supported the previous government for 9 years a lot of embarrassment.
Point of order.
Point of order, Sue Kedgley.
I seek leave to table 4 documents.
Sue Kedgley.
Thank you. The first document is an email dated 19 May of this year. A caregiver on $13.26 an hour explains she gives out medicines for 46 patients, including signing for and giving morphine.
Leave us sort of table that document. Is there any objection? There is no objection.
I seek leave to table another email from a caregiver on 10 June explaining that on many occasions they have found residents lying on the floor for 2 or 3 hours after a fall before being picked up.
Leave us sort of table that document. Is there any...
I have removed the name, but the document is here.
Order. Leave us... Order. Let me just clarify for the House. Is the name of the person who sent the email on the document?
No, I've removed the name of the person.
So we've got no idea who's making this allegation. Members are aware of that. I put the leave as sought to table the document with no name on it as where it came from. Is there any objection? There is objection.
I seek leave to table a nurses' organisation aged care survey 2009, which points out medication is frequently administered by caregivers without the supervision of nurses.
Leave us sought to table that document. Is there any objection? There is no objection.
And my final document is 17 May, a nurse who says she's left the sector because she can't stand working in an environment where she's unable to ensure patients receive the care that they're entitled.
The person who sent that letter got their name attached to it?
I've removed that name.
Leave us sort of table that document to which no name is attached. Is there any objection? There is objection. Question number 3, David Bennett.
Mr. Speaker, my question is to the Minister of Finance. What reports has he received